Welcome back to the channel. Thanks for joining me here at Unapologetically Progressive. Now, today I have a news story for you out of Kansas. Now, Kansas has been dealing with tuberculosis. Apparently, over the last year, the media hasn't really covered it until recently. I heard about it about 2 weeks ago, I think, is when I first heard about this going on. And I've been trying to figure out how to put together a video for it. Now, tuberculosis is a very contagious disease that can spread very easily among people. All it takes is people, basically breathing, singing, when you're being around them when they have active tuberculosis. There are active infections and there are latent infections. Latent infections are basically people that may have TB in their system, but it's kind of like dormant. It doesn't do anything. It doesn't make them ill, and it doesn't make anyone else around them ill. Then there are active cases of tuberculosis, which will actually spread to other people, and it has unfortunately taken the lives of at least 2 people in and around the Kansas City area. Now, currently, these are the numbers. Wyandotte County has roughly, I believe it's 60, it says here, and then it's going to be 7 in Johnson County. These are the active cases, people having active tuberculosis currently as I make this video. Now, like I said, 2 people have passed away. I'm hoping that those numbers do not get any bigger than that, but tuberculosis can be very deadly for some people, especially if you have, other circumstances, other complicating factors, just like with any virus or disease or whatever, right? Now, tuberculosis is caused by a bacteria, and there is a vaccine for it, but we don't use it very often in the U.S. for a number of reasons. Some of it being the risk to getting tuberculosis in the U.S. is very low, and most people can survive it with the right course of antibiotics. And as well as the protection doesn't outweigh the potential risk of that particular vaccine. And we don't, so that's one of a few reasons we don't use the vaccine here in the U.S., at least from what I've been reading. Further, from what I've been seeing as well, is that it interferes with the ability to take the easier tuberculosis test, which of course is that skin test where they put they basically, if I remember correctly, they kind of inject it under something under your skin, and after a few days it comes up and shows you whether or not you have TB or not. I remember having to do that before I went to college back in 1999. So these are a number of reasons why we don't use the vaccine. Low risk, and the risk of the vaccine doesn't outweigh the risk of actually contracting tuberculosis in the U.S. Now, around the globe, it's one of the main causes of communicable disease across the globe, especially in areas where they don't have access to some of the same medical help. And so in other parts of the world, the vaccine is used and it's necessary because of the prevalence of tuberculosis. It's one of the most contagious diseases the world has. Now, if you want more information on actual information about tuberculosis itself, its percentage around the globe, and how deadly it can be, check other platforms. I don't know. He may be here on YouTube still. I believe he is part of the Vlog Brothers. John Green. He's been talking about tuberculosis for a good few years now, trying to explain to people how serious it is. And I believe he can do a better job at explaining exactly how tuberculosis works, how it spreads, and how we can mitigate the spread of tuberculosis. I believe John Green is a good source for that information. But also I follow him over on TikTok. He's, I believe, on Instagram too. And so if you find John Green, I'm guarantee you he will be able to give you some more information about that. Of course, he's written a few books as well. I believe Fault in Our Stars, I think, was one of his. I can't remember exactly. But apparently, this is what's going on in Kansas right now. Now, so far the spread has not been wide, right? It's just been mostly in these two counties. Now, there have been a total of 79 cases throughout the state of Kansas in the last year. These are the active cases, and there were a total of 213 inactive cases that they knew of um, in and around Kansas. Now, the problem with that is they've never noted, they haven't really explained, you know, everything about it, right? They haven't done a very good job of explaining the numbers, because they say there were 79 cases, but not all of them were connected to this particular outbreak. So it tells me maybe there was a smaller outbreak somewhere else in the state, but I don't want to speculate on that. But these are the numbers we're at right now. We have 67 total cases in those two counties that are affected by this, and 79 latent cases currently in the state of Kansas in these two counties. Right now, it's not a threat really to the general U.S. public, but I'll definitely be paying attention to let people know if that happens to change. It is not the largest outbreak in U.S. history, though, unlike some of the people Kansas health officials had said earlier last week. It is not the largest ever in the United States. There have been some others. Let me read you these others that I've seen here. Um, right here, it says public health workers identified more than 170 active and 400 latent cases in an outbreak from 2015 to 2017. There's also another outbreak in 2021 that went through homeless shelters in Georgia, sickening 113 patients. So there are 113 active cases in that one. And so it's not the largest ever in the United States. It is definitely a large one. It is a lot bigger than we would want it to be, but it's nothing on the line, on the scale of the flu or, COVID-19, right? It's nothing on that scale, on the number of people that are contracting this bacteria. You literally have to come in contact with the people or touch the surfaces that they've been recently coughing on. Some of the symptoms include things like night sweats, coughing up blood, fever, things like that, right? These are definitely things that would make you want to go to your doctor and see what's going on. Now, tuberculosis can be treated. It's not like it's untreatable. You have to go on a course of antibiotics. It takes several months. I believe I've read as far as 8 months of a system of antibiotics to get your system clean from the bacteria. But like I said, just if you're in these areas, definitely take precautions. I would keep my hands washed. Wear gloves in areas where you need to, and wear a mask if that's what you need to do to keep yourself safe, especially if you're working in close contact with people that may have active tuberculosis infections. Anyways, that's all I got for you about this right now. Thank you for joining me here at Unapologetically Progressive, and I'll see you down the road.